Okay. So hi everyone. My name is Shazia Khan, and the unit we're doing today is effective communication in health and social care, and we're doing learning outcome 3 today, which is the final learning outcome, and then we've got the assignment discussion tomorrow. So before I go into learning outcome 3, I want to just give you an overview of the last learning outcome that we went through, which was learning outcome 2, and just give you an idea of what we went through when we went through learning outcome 2. So learning outcome 2 was to understand the communication needs and preferences of individuals. We went through what communication needs are and what the preferences are of individuals and why there's a preference for different people. We looked at different sources that emphasize different approaches. So how the person feels, their person-centered approach, their needs, using their a way of communicating with them. And we looked at the comprehensive understanding, so different styles and things as well. We looked at elements of theories of effective communication. Well, we looked at the linear theory and the interactive models and the transactional models, and we looked at them in a lot of detail, so you're able to understand what each model means. So if you're able to talk about it in your assignment, you're able to understand what each model contains. Okay. So we looked at also the advantages of the models in regards to the interactive model, transactional models. We also looked at Screm's model as well of communication, which includes a feedback loop and then the process of encoding, decoding, and interpretation. We looked at exploring different models, of communication further through different sources, like the communication process and things like different principles, theories, and methods of effective communication. We then went on in learning outcome 2 to look at explaining the importance of determining an individual's communication needs. For example, if someone has dementia, it's really important that you understand their communication needs because their memory is deteriorating. So if you're able to adjust your communication around them, then it's really important that you're able to understand what kind of, what that individual needs, because, that individual is not able to communicate anything to you because of their illness. We then went on to look at different ways you can assess or review the individual's needs and preferences for communicating. Things like asking the individual how they prefer to communicate. It's really important to talk to it's all about the individual to make sure that you're able to communicate with that individual. Observe the individual, so if it's possible to determine their communication needs and preferences. Also ask other people that work with them. There may be other people that work with them. You're able to identify that. So talk to them and read their file and their care plan. What would their care plan identify to you, Vida? What does a care plan have in it? Vida, what does a care plan have in it? So a care plan it literally has what the person is, is obviously what their needs are, what their medical notes say. So you need to put a plan together in regards to that. Also, we looked at elements of verbal communication, which is their vocabulary, the tone of their voice, the pitch of their voice, because it's really important. Sometimes people talk really fast or really high pitch, and sometimes people find it difficult to understand if they have a low pitch. The volume as well. Listening is a really important part of verbal communication. It's one of the main points. Active listening, so how you would sit in the solar position, sit squarely, open posture. The OL is lean towards the other person, eye contact, and relax. And that is an element that's been used quite a lot in the health and social care profession. Then we've got written communication, and we've got body language, touching, gestures, behavior, the use of interpreters and advocates. Why is that so important within an organization? Communication aids, so charts and books, pictures, communication systems, PEC system, braille symbols or speaking aids. We looked at sign language or Makaton as well. And we looked at a diagram with all the elements of different ways of exchanging communication. And we also looked at services and resources to promote effective communication, like interpreters, websites like England NHS, advocacy people, autism. We looked at support groups and also information from the internet. So that was in regards to learning outcome 2. Now we're moving on to learning outcome 3, which is looking at elements of understanding barriers to communication. So when we talk about barriers to communication, it's really important to understand why barriers, what barriers are in, will hinder someone communicating with you. So the indicative content for today's session is to look at barriers to effective communication. For example, language, ethnicity, culture, the environment, skills, ability, disability noise levels, distractions, sensory awareness, terminology, well-being, mental health is really important. How to overcome these barriers of communication, for example, effective listening skills, using adaptations and aids. If the individual is not able to communicate without them, you need to make sure you are using them. Using aids like advocates, interpreters, active communication skills, use of body language, the use of an appropriate environment, building trust and meeting communication needs, so safeguarding and confidentiality as well. Let's watch a video. So this video here is on barriers to effective communication. So why they were in place, and why there was a need to have them in place at that time as well. So when we look at barriers in communication is really, really important in the health and social care profession. It's important in every profession. And it's obstacles that are there that hinder the clear transmission and understanding of a message. Often arising from factors like language differences, cultural variations. It might be physical distance, it might be emotional, it may be, where you lead to misunderstandings and lack of communication. So it's really important that, you're able to identify the barriers. Within health and social care, so there are different barriers in place within health and social care. And it could be things like, lack of health literacy, they don't understand any sort of medical jargon, or any disparities, environmental distractions, and that can affect and hinder any sort of relationship or communication between any sort of healthcare providers and patients. If they don't understand what you're saying, Vida, it's really, really important that you make it clear to them. The language is a big thing, and especially using medical jargon, which they are not likely to understand anything. So you need to make sure that it's clear. So some barriers to effective communication, like we looked at it, elements of noise, noisy environment, that's another, distractions. They can cause, elements of noise, loud noise. If someone is also having some problems with difficulty hearing, that could be one. Also elements of that uncomfortable environment, such as lighting. So the environment is really important around you. Noise distractions, poor lighting, or heating, the temperature is so uncomfortable, and can disrupt any sort of communication. A lack of privacy is another one, which is quite important. Lack of privacy within and elements of that. So you could have lack of privacy, could be things like, the fact that they're not able to share much information with you because maybe they're sat in an environment which is not confidential and that people can overhear things. So, they would want an environment where they can talk about things freely. A lack of understanding awareness of individuals' needs. So, you have lack of understanding of the individual's needs, what they want, what they require. Um, and where people do not understand other individuals, it's really important. You need to identify that people don't understand other individuals. You're able to, put in place these barriers, making sure that your message has gone through to that person. It could be anything. It could be elements of, technical faults, times. Within health and social care, we've got the next one is quite a big one, actually, cultural barriers. Within health and social care, you have cultural barriers, and trying to understand people is another element of it as well. It's difficult. If they don't understand what you're saying, it may be that they feel like they're ignored. Differences in languages. It could be, the accent and dialect can make it hard. Fida, within your job role, have you seen problems with cultural differences? Vida, are you able to talk on?
Yes, yes, I'm at work, so
Oh, okay, okay,
sometimes, yeah,
okay. So you've seen differences at work,
yeah,
and do you struggle sometimes with languages or their beliefs and things like that?
sometimes, yeah.
Yeah. But it's very important to accept everyone's cultural beliefs and how they speak, their values and customs are different to ours. So, and that could lead to misunderstandings when communicating in case you say something wrong that and the first person feels, like, oh, they not respecting our and our values. Different cultures may use different symbols and different, symbols and different signs and things. So you need to take on board, what they take on, and it may be, you have to educate yourself to provide the cultural differences to appropriate communication. Make sure, you are able to look at them, and speak to them and respect their cultures. Poor use of unavailability or communication aids such as hearing aids. So if these not available properly, you need to make sure that they're available and so they're able to communicate. You need to make sure people with dementia, any sort of learning difficulties are in the um have the ability to process any sort of information. And if you haven't got the communication aids in place, then it's not supporting that individual. The use of jargon or slang terminology, again, the language whilst to use medical jargon, using complex medical terms and patients may not understand can create a barrier to comprehension. So they need to make sure they understand what they are saying. You are saying, and you use the use of medical jargon. The individual's condition can be a barrier. So if the individual is, ill, or if they've got any sort of if they've got any physical impairments or anything, their mental health, it can impact on an individual's, how they actually say something, or how they actually they may feel withdrawn, they may feel emotional. So you need to make sure that the barriers are in place. You are able to support that person. If that person is autistic, or if that person is has dementia, you are able to support that individual as well. The other one is in the individuals may prevent attitude, their attitude to communication. It may prevent them if they're aggressive or withdrawn, or they don't want to talk to you. So that might prevent them as well. So you need to make sure you are able to support that individual. And your own attitudes and feelings and values and beliefs can present a barrier. So what you feel as well is really important. You need to make sure you are in place, you are able to understand that individual. If you can't understand that individual, then you're not able to, that relationship won't be right. You're not able to identify that that person is you're getting the right information. If you're not communicating with that person properly, then that person won't feel comfortable with you. So you need to make sure that you are able to communicate with that person properly and make sure that you have put in place, if there's any sort of elements of any sort of resources or anything, everything is put in place for that individual. So the next one is looking at the 3.1 is looking at explaining the the barriers to effective communication. So you've got physical barriers in communication, okay, and you're looking at the element of physical barriers. So what can physical barriers be? It could be elements of just so physical barriers could be things like a hearing difficulty. It could be the fact that there are elements of our structural or transportational obstacles restricting them. So anything that's restricting them. So it could be things like physical barriers could be noise. It could be faulty equipment. It could be the distance. And it could be poor lighting as well. Physical barriers may be poor lighting. It could be within health and social care. It's, there are different barriers to communication, and physical barrier in health and social care is obstacles that are avoiding you to, take on board any sort of examples could be things like, elements of a noise, distance. It could be communication in health and social care. It could be it could be the fact that there's environmental restrictions around, any sort of environmental descriptions that may be causing something. That could be an element of it that could affect any sort of, if there's any frequent disruptions around, that could affect any sort of elements around there. The next one, it could be physiological barriers. So it could be hearing impairments. It could be, the element of difficulty hearing. So anyone that's got difficulty hearing, it could be that. It could be elements of speech difficulties. So if they have speech difficulties, that could be an element of it. And also it could be elements of visual impairments. So they can't read. They could, visually they need support in regards to that. And then it could be cognitive or visual impairments, cognitive. And then we've got carrying on with barriers, just psychological barriers in health and social care. And that can be emotional and mental health issues that can hinder a person's ability to change or improve their situation. It could be the fear or stress and anxiety. It could be the fear of worry. People are scared to worry, to use services. Mental health issues, that could be, the fact that they've got emotional or behavior problems that are caused by subjective interpretations of their experiences. Maybe they've had bad experiences and they are biased and not listening. Stress can lead to reactive behaviors such as drinking more, maybe, and psychological barriers can influence how people experience health and illness as well as health behaviors, their beliefs, so it could be a factor of things that influence that. One of the most popular ones within health and social care and within a lot of settings is language barriers. And language barriers refer to a situation where a patient maybe and a healthcare provider cannot effectively communicate due to lack of shared language, which can significantly impact on the quality of care provided by causing misunderstandings, misinterpretations, and potential negative outcomes. Do you think language plays a big role, Vida, within health and social care and within communication?
Yes, please.
Yeah, yes, it does. It impacts on it a lot. When a language barrier exists, it can actually hinder the exchange of medical information, treatment plans, care plans, and any sort of errors in diagnosis with the individual because they can't understand you. So it could be elements of language trying to get someone to, and the use of jargon. Stop using medical terms that the individual doesn't understand and they are unfamiliar with. The next one, which we've looked a little bit at, which in regards to it, in a little bit more detail, is cultural barriers. So cultural barriers are challenges that arise when people from different countries try to communicate. So these barriers include things like language differences. It could be their cultural norms. It could be their cultural values and non-verbal communication. So examples of cultural barriers, your language, your stereotyping, being biased against someone's culture, your norms and values. So different cultures have different ideas about what's polite, how to treat authority and business conduct, body language, your conflicting values. So it may be that you may not agree with the values, but you've got to take them on board and make sure that you put them into place because you are respecting their values and beliefs. Systematic barriers of communication refer to obstacles that obviously slides Vida, because there was a bit of a Vida.
Yeah,
Can you still see the slides?
it's a bit smaller.
Okay, so let me just try to increase that. It's just that the internet went a bit AWOL, so let's have a look. If we can increase the size a bit. So systematic barriers are in some settings, you have a hierarchy, so who's at the top end of the hierarchy and how they work as well. That's a systematic barrier. Lack of training is really important because you have to train your staff to make sure that they know what they're doing. If you don't train your staff, they will not know what they are doing. So you need to make sure you are training them properly. Don't know what's and now just give us a minute. Let's see the slides. And then you have attitudinal barriers, lack of interest of relevance. So someone who feels that isn't relevant to them, they might not pay attention. And someone who feels resistant to change as well. People don't like being able to change things. So when people don't want to change, then it's difficult, to change their attitude to what their beliefs are. The next one is information overload, and that's really interesting that, because that impacts on individuals quite a lot. When there's information overload, people don't want to listen. It's too much information for them to get through. So because they don't want to listen, they're not going to listen to what you're talking about or anything. So people will identify things as, they'll ignore things. They won't retain any sort of information. And also, lack of feedback. Again, another element of information which is misunderstood. If anything's challenging, then no one's going to listen to that. With feedback, it's challenging to get on with people as well, to make sure. And poor listening skills, that is a big one. Community listening, like we said, listening skills is really important in any organization. And if you're not listening properly to what the individual's saying, you're probably not able to get, through to what they are saying. So poor listening skills are easily distracted and may even create disturbances for individual that interfere with their own listening efficiency. So it's really important for you as an individual to make sure that you're listening to that person. It's one of the things that we don't tend to do quite a lot sometimes, but that will hinder the element of communication. Poor listening skills can lead to misinterpretation, misunderstanding, or miscommunication. Assumptions and jumping to conclusions, that's another one. Making assumptions and leading to conclusions, which is a really big one as well. 3.2, identify how to overcome these barriers to effective communication. So, you need to make sure you overcome barriers to effective communication. And how would you do this? You need to make sure that you are avoiding the use of any sort of jargon. You are checking whether it is good time and place to communicate with that person. Not speaking too quickly is another one, and communicating one thing at a time. Respecting the person's desire to not communicate, and you are using, the right aid for that person, making sure that you've got aids in place for that person. You need to make sure that, you are communicating it properly to that person. And you're checking whether it's a good time, a good place, respecting that person's desires, communicating, being clear and using language that they understand. Communicating in a location that's free from any noise or environmental elements. And you need to bear in mind what their communication is, how they want to communicate with you. So you need to make sure you bear that in mind, because it's so important that you are communicating the right way with this individual. Because if you're not communicating properly, then that individual is not able to understand what you are communicating to them. So you need to make sure that you are listening to them, you are taking on board and how they want to communicate, and to overcome these barriers. You are putting in place aids in place. You are making sure that there's no environmental issues, there's no issues of time constraints. Information overload is another one, which you're not giving them too much information, and making sure the background noise is clear, because it doesn't affect the person's ability to hear, or make sure that you're in a quiet space as well for that individual. You need to also bear in mind that the individual again, jargon is important in communication. Avoid using any sort of jargon, to avoid any sort of technical or any sort of clinical language that they don't understand. So make sure you are looking at that. Applying theories as well. Sometimes it's important to apply theories in practice. And the one we've looked at here is Shannon and Weaver's model, and how that applies in communication in regards to health and social care, how Shannon and Weaver's models apply. So make sure you are looking at that. So if it's the noise, information source, transmitter, channel, receiver, and destination. So make sure you are taking that on board, sorry. In relation to the summary, for effective communication to take place, you need to overcome the noise. This means that you need to acknowledge your own negative feelings or attitudes and beliefs which affect communication. You need to empathize with the individual and think about these negative feelings you have. Make sure you're not stressed, because you don't want to go into communicating with someone when you're stressed and you are not taking on board what they are saying. So you're listening to them. Listening, again, and I will reiterate this again, is one of the skills that's used quite a lot, but it's one of the most important skills in communication. Making sure you are listening to the individual, making sure you are communicating with them so that they're not able to feel stressed or anything about that. So in relation to, sorry, next slide, in relation to external barriers, you should ensure that you're physically able to communicate, that you're not feeling hungry or you're not tired or you've got, it's a good time to speak to them. You've got the time to speak to them. You've not got anything else on your mind because, you need to make sure you are listening to that person because that person needs your full attention. So you need to understand that you have got a poorly person. You need to listen to that person. The environment, you need to make sure that the environment you are dealing with is really, is a good environment. It's not too loud, not too busy for that individual because you need to take into account that individual's needs. You need to make sure that you are looking at the individual's need and making sure that, you are taking into account that there's not a large amount of noise. They're able to understand it's a safe space for them to talk. And you need to meet that individual's communication needs. So you need to understand what their communication needs are, before you can deal with them. Is there any language issues? You know, you need to make sure that it means you need to understand if they need any sort of aids or anything, or if they need communication aids, if they are, able to speak to you or they're confident to speak to you. So you need to able to take all that into account as well. Dealing with difficult people, conflict and aggression. So conflict is a natural thing that happens sometimes. It's sometimes in your life you need to be described as two people being incompatible. Where there's aggression and conflict between person, you need to remain calm. It's really important to remain calm with that individual. You need to make sure you are, in a situation where you are calm, and you need to make sure that you are always listening to that individual, and making sure, bear in mind the environment as well around you, making sure that you are, when you're dealing with any conflict, you need to make sure that other patients are not there as well. Act and speak calmly with that individual, make sure you are calm and professional. Maybe try to implement positive confrontational techniques. Choose a neutral space, like we said, analyze the expectations. So what are the expectations? Are they different from your expectations? Listen and clarify the issue on both sides, really important. And work together to tackle the problems and understand the different perspectives. They may have different perspectives. Be patient and understanding. Again, active listening plays a big role in this, making sure you're actively listening, and evaluate the situation, avoid any sort of, elements of being, not understanding the individual, making sure you understand their culture, it could be anything, but you need to make sure you are understanding that individual, and making sure that you're trying to resolve the situation, you know, try to identify the issues, encourage any sort of empathy, stay calm, analyze the expectations, encourage professional behavior, so make sure that you are able to understand what they're feeling, what their perspective is. You need to be able to do that because that individual is so upset. You need to be able to identify elements of that. Be aware and identify any emotional triggers. So no one wants to be frightened, any sort of angry or embarrassed in situations where a person feels like that. Make sure you are able to communicate effectively with that person. You need to be able to understand these, barriers because, you need to be able to understand individuals, how they are feeling, how does that impact on what they're saying to you? So you need to be able to understand them and identify them. Next one is looking at transactional analysis. And this transactional analysis is elements of, you know, the basis of human transactions, sorry, within health and social care. So it's analysis of a psychoanalytical theory and method of therapy where social interactions are analyzed to determine the ego state of the communicator as a basis for understanding behavior. In transactional analysis, the communicator who is taught to alter the ego state as a way to solve emotional problems. So you have the parent ego, and you have the first one, the parent ego, which is the first step of the transactional analysis. So you've got to look at the element of that. Then the second one is the adult ego, which is the second stage of the analysis. And then the third one is the actual child ego, which is the emotional state, you know, so you need to take on board the emotional state of the individual. And a child ego communicate based on when the child ego expresses natural instincts of happiness, and you have to, you know, adapt to that. So depending on what ego falls within the transactional analysis, you've got to make sure you adapt to that. Individuals adopt to the different egos in different interactions with others. When interaction, they will make assumptions about their ego. So, for example, A, did you manage to finish that report? Adult to adult. B, not quite. I told you I needed it it by this morning. Critical parent to a child. Then I thought I told you when I needed it by morning. That's a critical parent to a child. It's not my fault. I had to take Jenny to the doctors yesterday, and you didn't give me that much notice. Adaptive child to critical parent. And do you need some help with it? Nurturing parent to child. It's under control. It will finish the next half an hour. An email. That's adult to adult. So you have to bear in mind the relationship that identifies the type of ego that you will fall within. So it's really important and how you communicate, and that is an impact on positive communication. Useful techniques for resolving tension or conflict in a situation. Again, using adult ego to ask your opinion, appealing to the other person's nurturing parent by asking for advice or expressing their feelings. On the issue, if you think you can talk to the child ego, you may be able to lighten the situation. And your child ego, and bear in mind that this is the child ego is quite a hard ego to deal with stuff, because you know, you have to get into the child's mind and deal with what they're feeling. The next one is de-escalation techniques. So when barriers in to communication come in place, you know, you have to make sure you are trying to de-escalate things. And these are techniques to help someone calm down if they're angry or upset, to try to control things. And verbal techniques could be speaking to the person on one-to-one basis. So maintain this safe distance and avoid touching the other person. Listening to that person, so give your full attention to that person. And also nodding, you know, making sure that you're nodding to that person, avoiding being defensive, you know, ignoring abusive language. So if they're upset, ignoring their language, avoid changing the subject or interrupting, and empathizing with that person. Make sure you empathize with that person. It's really important to make sure you are empathizing. If someone is down, you know, make sure you are empathizing with that person, and, you know, staying in control with that person and making sure that, you know, you are dealing with the situation. Non-verbal techniques, so open body language, minimize movement, like we said, avoid any sort of touching, and it's keeping that safe space for that individual, and having their personal space, and make sure you have clear access to the exit in case anything does happen. You know, you've got to look at your own safety as well as the other person's safety as well. You know, you need to make sure you are making that situation quite calm, listening, empathizing, the use of non-threatening language, avoid anything like that. providing a safe space, and also trying to involve others if the person will allow you. Listen to what they're saying, because sometimes people feel like they're not being listened to, and make sure that, you know, you are calm all the time. How to check the understanding when communicating. So when communicating, it's important to check that the person has understood what you are communicating to them. So you are observing facial expressions and body language. You're observing behavior, asking the other person if they have understood what is being communicated, rephrasing questions and asking questions, and requesting for the other person to repeat back the information, so you know that they're understanding what you're saying. Because, you know, if that person is unable to understand what you are saying, then the effectiveness of the communication is not going to happen. So you need to make sure that you are, you know, observing your making sure that you are listening to that person, you are taking on board what that person is saying, to identify any sort of additional information or additional questions. You are making sure that, you know, you're asking the person if they have understood, because that person needs to understand what you are saying. If that person doesn't understand, then what is the point of you saying anything? So you need to make sure that they are understanding and everything is clear, because, you know, remember, sometimes, you know, the word use of language is a big thing. So pay attention to the words and actions, ask questions, and watch the body language. Also, you are responsible for making sure that messages are communicated accurately. So, you know, you need to make sure you look at the tone of your voice, the body language, how you could understand the individual, simple confirmation that they understand. You know, asking them, are you able to understand what we're saying in your own words? And they will speak to you about that. So making sure you're doing that as well. So in this section, we've looked at barriers to communication. So I'll just give you a summary of what we've looked at in this session, so you've got a little bit of an idea of what we looked at. So we looked at understanding barriers to communication. We looked at the different barriers to effective communication and what could include noisy environments, lack of privacy, lack of understanding. We looked at cultural differences, language barriers. We also looked at the poor use of unavailability of communication aids, hearing aids, maybe hearing loops, the use of jargon. The individual's condition may present a barrier to communication. We've also looked at physical barriers, physiological barriers, psychological barriers, such as maybe stress or mental health or this sort of prejudice. We've also looked at language barriers, different native languages, jargon and technical language, cultural barriers, and systematic barriers. We've looked at attitudinal barriers, so lack of interest, someone who's got no interest in it, and someone who's resistant to any sort of change as well. We looked at lack of training. We looked at cultural stereotypes and prejudices as well. We looked at information overload, and sometimes receiving too much information at once can be overwhelming for people, and they want to understand what's going on. Poor listening skills, so it's also about listening, and that could hinder your understanding. So if you're not listening to that individual properly, then that could identify that, you know, you are not listening to that individual, but also not taking on board what they are saying. Assumptions and jumping to conclusions, and that's a really interesting one, where we all, you know, try to jump to conclusions and make assumptions as well. So you need to make sure that you are not making any sort of assumptions in regards to what the individual is saying. And identifying how to overcome barriers to effective communication. So avoiding the use of jargon, making sure that we're ensuring good communication aids, making sure that you are not speaking too quickly and speaking clearly, ensuring communication with individuals is in a private space, ensuring the environment is comfortable for the individual to be able to talk, and taking time to learn about the individual's person's communication needs and preferences. We also looked at the theory of Shannon and Weaver, and we also looked at external barriers, physical environmental and meeting the communication needs. We went on to look at dealing with difficult people, conflict and aggression, how you clarify the situation, keep calm, analyze expectations, and look at understanding different people's perspectives. We looked at how to be aware of identifying emotional triggers. We looked at the transactional analysis, so the parent ego, the adult ego, and the child ego. We also looked at elements of using different techniques to resolve conflicts and de-escalation techniques, and how to check understanding when communicating. So these were the elements that we've discussed in Learning Outcome 3, which is the last session. The next, this is the references we've used for today's session, so you can actually go onto these references to help you. There's links to that, and this is all available on Moodle. There's additional resources, ebooks, any sort of additional case studies, which I'll show you tomorrow as well, when we're doing the assignment discussion. Further reading, there's some additional links there that you could go on to do any further reading. There's some really good links there on mental learning, communicating with people with learning difficulties, and 3 must communications. Have you got any questions, Vida, before we finish the session? Oh,
No, please.
okay, so if you've got any questions, any queries, please email learnerwork@ukvarsity.co.uk, and the submission of the assignment is to be done on learnerwork@ukvarsity.co.uk. All the recordings for all the 3 learning outcomes will be on Moodle for you, and any ebooks, any journals, any sort of extra additional reading will be on Moodle for you. So if you have any issues with Moodle, please email again learnerwork@ukvarsity.co.uk. The next session we will have is the assignment discussion session, which is tomorrow at 10 o'clock. And then once that session is done, then you will be able to get on with completing the assignment and submitting the assignment. So we finished the session now, Vida. You have any final questions or anything to ask? Vida, no?
No, please.
Thank you. Thank you for attending today's session, Vida. And I
Thank
will
you
see you
too.
tomorrow, okay? Thank you.
Okay, thank you too. Bye.
Bye.